Hi there and welcome back to the channel. Today's video is a follow-up to the one that I did on health tourism and features more information provided by the Portuguese Minister of Health, Ana Paula Martins, about the extent to which foreigners and especially uninsured foreigners have been using the SNS. So the Minister of Health appeared at a parliamentary meeting earlier this week in which she was quizzed by various members of parliament about the state of the health service. And at this meeting, she revealed a very interesting statistic. And that was that in the year 2024, until the 20th of September, not until right now, which is obviously November, but until 20th of September, just over 50,000 foreigners had received medical care and attention provided by the SNS, and that all of those foreigners were either uninsured or didn't have the correct protocols in place to enable payment to be extracted from them. In terms of not having insurance, I think that's very, very easy to understand. These are people who have no medical insurance and they probably are not members of like the European health card scheme or anything like that, not from other EU member states. I would think the majority of them definitely not. Thinking about lacking the proper protocols, I have to admit I'm not exactly 100% sure what that means, but I assume it means that there's no bilateral agreement in place between Portugal and their country of origin which covers medical provision, and that in addition to that, those people have not managed to obtain a numero de utente, a health user number in Portugal, or even a social security number that would enable them to be treated as Portuguese residents usually would. Now, I find this phenomenon to be quite disturbing, that such a vast number of foreigners are being treated basically for free on the SNS, and we have no way in Portugal of recouping this money from them. Many of them will in fact leave the country, move on to other countries, and the money essentially just goes down the drain. And I am especially alarmed by the kind of rising trajectory which has been revealed in the statistics that Ana Paula Martins provided to Parliament. Ana Paula Martins obviously commented that in the year to September 20th, 2024, there were 50,000 foreigners that had received treatment. But the more disturbing statistics by far are those which relate to the rate of increase in this kind of practice. She commented that in 2021, of the foreigners that were treated on the SNS, 32% of them were in this category of uninsured. In 2022, it rose to 37%, in 2023 to 40%, and in 2024, this year, year to date anyway, it is now up to 47%. So that's a rise of about half in the scale of the problem, just in percentage terms, over the course of 3 years. And when you consider that the underlying raw number of 50,000 is probably increasing as well as the percentage, I think that indicates that this is a very real problem. The health minister was also anxious to point out that although these people were uninsured and although the correct protocols were not there, the SNS doesn't turn anyone away. It's really just like a welcome sign for anyone from around the world with a health condition who wants to come to Portugal and exploit the resources of the SNS, which are paid for by the Portuguese taxpayer. And I think it sends a very, very wrong signal on this issue. The SNS should and indeed must turn these people away. It simply must deny treatment in these cases. It is simply unsustainable to be providing free medical care, and some of the medical care which is provided is extremely expensive medical care, as we touched on in the previous video, things like transplant operations and stuff like that, that people have actually ported themselves into Portugal just to receive. So it has to stop. The Portuguese taxation system, the fiscal burden in Portugal is already high enough. Waiting times for ordinary Portuguese are already, through the roof. The situation is bad. We cannot afford to exacerbate it by sending the wrong messages to people who basically have no right to avail themselves of free healthcare in Portugal. They're not citizens, they weren't born here, they're perhaps not even legally resident here, they haven't obtained the correct, health numbers and things like that. They just haven't done what they should do, or they're in some kind of irregular situation. We have to stop providing free healthcare services for people in those kind of situations. We just have to. Portugal is not a charity. I know that there will be a lot of people out there who will think, oh my God, we have to help people. But Portugal is a small country. It's not an especially rich country, and it doesn't have the resources, whether that's the financial resources or medical resources, to take on the medical problems of the developing world. It just does not. And we have to realize that. And we have to start putting Portuguese people and legal residents in Portugal who actually have the correct numbers and are in the system, we have to start putting those people first. One thing that I should just quickly note is that although there's figure of 50,000 foreigners who were treated in uninsured condition in 2024 year to date seems very high, it pales into insignificance when you consider that over 6 million people received hospital treatment on the NHS in 2022. That's the last year that I can find statistics for. But it's obviously a very small fraction, but it's still an important fraction, and I think the point has to be made that this is not okay. It's just not. The key points here for me are simply that it's very unfair that these foreigners should come here in an unregularised, uninsured state and pay nothing. I just think it's horribly unfair. Secondly, it not only increases the fiscal burden on the Portuguese tax residents that are here and have to pay for this, but it also exacerbates waiting times, many of which are already excessive in Portugal for all kinds of procedures. And if you go to an accident and emergency room in Portugal, you're guaranteed a long wait, and this is something which is contributing to that problem. Thirdly, immigrants and foreigners generally, and I would even include myself in this, if they go to a hospital to seek medical treatment, most of them don't speak Portuguese very well, and I think that will lead to longer delays than people who do. I have to be honest with that, because there are more questions to be asked, there are more doubts to be addressed, not familiar with the procedures. I think that they will clog up the system to a far greater extent, and it's especially appalling if they're not paying for it. And lastly, I just think that Portuguese people, Portuguese citizens, Portuguese legal residents deserve better treatment. These are the people who are fundamentally paying for the system, and therefore those are the people who should be its principal beneficiaries. There should not be a case where a bunch of foreigners from overseas with who knows what kind of medical conditions can come to the country and get priority or get treatment and just disappear without paying, and the Portuguese are left with long waiting times and a big bill when it comes to paying their taxes. To me, that's just an atrocious situation, and it needs to stop right now. Alright, well that'll do it for this video. I hope people found the content interesting and informative, and I'll see you soon in the next one.